Now, being a doctor is not an easy profession, especially in Iraq at a time when the coronavirus has taken the world by storm. Now, things still seem to look pretty bleak for the country. The United Nations has warned that the pandemic could actually spiral out of control in Iraq. Now, Iraq has been fighting the virus with depleted forces. The medical staff is both overwhelmed and under-resourced. The ill treatment of the doctors and the medical staff in many instances has left many of them wishing that they had opted for a different profession. The doctors struggle to keep up as the coronavirus numbers are rising sharply in Iraq. An Iraqi doctor, Tariq Al-Sheibani, was beaten unconscious by the relatives of a patient who died of COVID-19.
A person behind me yelled, "This is the head of the hospital, go attack him." I stopped. I did not have any issues with them, so I stopped and looked around to find a group of people, more than 15 to 20 people at least. They started attacking me for absolutely no reason.
Like many others, 47-year-old director of the Al-Amal hospital in the southern city of Najaf also woke up in the hospital with bruises all over. The medical staff and doctors are working within a health service that has been left to decay through years of civil conflict and underfunding. And now they're also facing the added threat of physical violence by grieving and desperate families. Now, dozens of instances of assault have taken place since the beginning of the pandemic, and it seems to be spiraling out of control in Iraq. Now, the video of Dr. Sheibani's assault went viral when the CCTV footage circulated online. The family of the deceased patient have blamed his staff for the death. Now, more than 8,000 people have died so far, a number that some doctors fear actually could rise pretty sharply, putting frontline health workers under big pressure and also in some cases at risk of physical violence.